Hi, welcome to our neurometabolic video series. My name is Dr. Sean Price, Clinical Director here at Chirospot in Fort Walton Beach, Florida. In this video we're going to talk about antibody testing for thyroid dysfunction. Again, in this video series on thyroid dysfunction, we're discussing why a lot of patients will actually be suffering from thyroid conditions even though their lab tests are normal, or even if they're on medications and their lab tests have been brought back into normal, but they're still suffering from the symptoms that originally brought them into their medical doctor for care. And we talked about the metabolic processes of the thyroid gland and the physiology of how the thyroid gland works, and we've reviewed some other things in the previous videos. So if you haven't watched the other videos, you may want to go to my website. It's www.drshawnprice.com, and on the home page you can click on the little tab that says Dr. Price's videos, and you'll find the other videos under that blog, or under that tab. Now, in the last video we talked about Hashimoto's autoimmune thyroiditis and how that was the most common condition, or that the autoimmune condition was the most common cause of people who are hypothyroid in the United States. Well, autoimmunity means basically that your body is making antibodies against itself, and in this case the body is making TPO and TGB antibodies, and those antibodies are attacking the thyroid gland, causing that thyroid gland to function below normal and leading to hypothyroidism. And again, most doctors run, when they run tests, they run TSH, they might run some T3, they might run some T4, but for the most part, they don't run the antibody testing. And this is one of those critical tests that you need to run, because if you have these antibodies present, you don't have a thyroid problem, you have an immune problem. Your immune system is attacking itself, and it's more than likely not just attacking your thyroid gland, it's probably attacking other parts of your body as well, whether you're aware of it or not. So it's very, very important. One of the things that we focus on here in our office is getting to the cause of what's going on. And it's very, very important to get to the cause of why your thyroid gland is not functioning properly. Beyond that, we have to get to the cause of why is your body making these antibodies against itself. There's a problem there. There's a reason that this is happening. It's not a normal response for the body to attack itself, so there's got to be a cause. Well, these are some of the causes. The first thing is what we call an active antigen. Well, what is an antigen? It could be a parasite. It could be a virus. It could be a bacteria. It could be a mold exposure. It could be fungus. And these things don't necessarily mean that you have a fever and that you're acutely sick or anything like that. You could have a subclinical level of some kind of a bacterial or viral infection, a fungus overgrowth, something that's going on inside your body that's causing malfunction, but that's not causing enough symptoms for you to know it's there. Another cause could be a food protein. It could be sensitivity to the casein in milk. It could be sensitivity to gluten. It could be sensitivity to any number of foods that are out there that could be causing this autoimmune response in your body. Immune imbalances can also be caused by stress, by hormone surges that come on from sugar dysregulation, or even chronic inflammation. So how do you know what's going on here? Well, as I've said in all the other videos, you have to test. You have to test to figure out what is going on with the body. And then you address the causes that you find and restore the body to normal function. And please keep in mind, I say this on every video, but if it's worth saying once, it's worth saying over and over again. It's very important that you understand that health is not, I repeat, it is not merely the absence of a disease or infirmity. Health is optimal function. It's optimal functioning physically, mentally, and socially. And you cannot rebuild your health one day, 1 week, or even 1 month at a time. You most certainly cannot rebuild your health one miracle diet, one great exercise program, or one miracle pill at a time. You can, however, rebuild your health and actually reinvent your life if you undertake and learn a customized program that helps you determine what the right choices are for you and for your body, and you make those right choices daily, one decision at a time. That's how you can reinvent your life. My name is Dr. Sean Price. We're here to help you do that. I hope you have a great day.